Hey, everybody. Welcome to today's episode. I'm thrilled to be joined by Michelle Lee. She is a passionate leader behind Care Nashville, which is a clinic right here in the Cool Springs area. They offer a lot of different holistic approaches to injury care and health. There's laser therapy, ozone therapy, stem cell. There's multiple things that I can't pronounce very well. But Michelle, thank you for hanging out for just a few minutes today.
Pleasure. Pleasure.
Tell me how you got connected with Care Nashville. I'll tell you in a minute kind of how we got connected as well.
Okay, just very succinctly, I practiced Western medicine for 33 years. I owned a company of vascular access nurse specialists, brought a thing to the world called PICC line back in the late 80s, hired a lot of nurses, and we supported every healthcare venue, hospitals, acute care, alternate care, hospice for anybody that needed vascular access, which means that's ubiquitous. That means we touched every diagnosis from cancer to hematology to infectious disease to strange things like fibromyalgia, which doctors often said wasn't even real. And I saw a lot of ladies and men drop between the cracks. Western medicine could not help. After the pandemic, I decided it was time to close that chapter of my life, sell that company, but I was not through healing. And I began to study functional medicine, root cause, hired a nurse practitioner, hired a physician in functional medicine, and began to learn functional medicine and alternative care. And I have to tell you, Tanny, the thing that convinced me that this was real was when a 5-year-old sickle cell child was brought to me in a sickle cell crisis. She had a choice to go to the intensive care unit, to fly her to Cuba for Ozone, but they found me in Brentwood, Tennessee for Ozone. We did Ozone 10 pass, and in 2 hours' time, the child went from a fetal position, contracted in excruciating pain, to running around this office singing happy birthday to my medical director's son.
Wow.
It totally changed from being in crisis to out of crisis with hydration and hyperozonization. And I said, oh my God, this is real. The world needs to know. And every sickle cell unit in every hospital needs an ozone machine, but they don't have them. It's considered alternate care. There's not a lot of money to be made in it. So I think it'll always be alternate care.